Good morning. I'm Patrick Erickson with the Inland COVID Response Joint Information Center. We appreciate everyone for being with us here this morning. Now, in just a few moments, we'll have an update from Spokane County Health Officer Dr. Bob Lutz, but also this morning we'll hear from Dan Barth, the Director of Communications with Inland Northwest Behavioral Health. And of course, if you have any questions at all for either of our speakers, be sure to share them with us right here on Facebook. We'll try to get to as many as we can this morning. But with that, we will start with Dr. Lutz.
Good morning. So today, Dan is going to be talking about mental health and behavioral health, and we have to admit this is an incredibly stressful time for all of us. None of us want to be here, and all of us are going to be dealing with these situations from a personal standpoint based upon where they've dealt with stress in the past. Dan will be able to provide some guidance from his standpoint as someone involved in the mental health and behavioral health field. Just from my standpoint, I really encourage people as much as you can to take care of yourselves, take care of each other. Look for those making use of social networks, albeit they may be distant social networks. How do you take care of yourself? It's by getting plenty of rest, by eating well, by exercising as you can. It's about doing all those little things that we always encourage you to do to, again, take care. And so this is a tough time. I mean, every night I go home saying, well, what decisions that I made today that could be impacting the lives of everyone? And this is a group effort. So really, collectively, I think we're stronger than the individual. And so I really ask all of you to work together to come out of this on the other side a better and stronger Spokane. It's tough. I think we also talk about, there's a lot of conversation about when are we reopening? And this is a part of our daily conversation, trust you me. I wish I had an easy answer. I wish I could say tomorrow or next week. And what it's going to look like, we don't know yet. I think this is a conversation that is shaped by both the science as well as by a lot of the social factors that go into this. This is an event that has impacted us both at the public health level as well as at the social level. Public health is a social activity. We are all part of public health. And so again, I just ask you to come together in this situation, to work together and understand that no decisions that are being made are made lightly, but we're really, again, focusing on trying to ensure that everybody is healthy. So with that, let me just go to some numbers. Again, yesterday's graph, you'll note, however, that we have had an additional 2 cases as of today, up to 315, and unfortunately 2 new deaths. So that gives our grand total to 19, excuse me. And we have currently 12 individuals who are currently hospitalized. So again, I continue to say that our numbers are encouraging. They're certainly flattening. They're certainly slowing. We are still seeing cases, however. I'm still seeing hospitalizations. And so we're not at the point yet where we can back off, where we can really open. Again, you've heard me use the metaphor of slowly opening the door, and I think it's adequate. I think it's appropriate. I think it's one of those situations where you find yourself with somebody knocking on your door late at night, and you don't have a light on. You're not sure what's out there, and you're going to open that door very slowly. That's what this response looks like going forward. It has to be a very slow, very calibrated response to opening. So I'll step aside, let Dan talk a little bit about, again, things that he would recommend to address your mental health and well-being. Dan?
Thank you, Dr. Lutz, and hello to everyone. Myself, as the Communications Director for Inland Northwest Behavioral Health Hospital here in Spokane, I wanted to validate to everyone what you've been going through. We have been through a trauma, and you continue to go through a trauma every day, psychologically, emotionally, and behaviorally. What impacts the way you're feeling is the fact that from the front side of when coronavirus or COVID-19 was first identified, we've had this sense of impending doom. And that's a powerful, powerful psychological impact to your brain and your overall psyche, because we hadn't had a sense of when this is going to end. We haven't had a sense of what is this, and that's from the onset. I'm not talking about where we are now, because now we start to gain more insight, more data, and understanding this even more. But what I wanted to address was the fact that if you're feeling stressed, anxious, any number of those things that are causing you to have difficulty functioning with your daily routine, your daily things, even the way you interact with family members and friends, it's not surprising. You have been through a trauma, and you continue to go through one every day. The coping mechanisms that you usually will use to mitigate stress, things like going to the gym, getting together with friends on a social level, of closer interaction, those have been robbed from you. They haven't been, they weren't taken from you in a way that was of consequence. They were actually like, wait, we are, for the own well-being of our community and yourself and your well-being, these are steps that need to be taken. So aside from the fact that you are enduring a trauma, psychologically, emotionally, you're also on a daily basis having to figure out a way to mitigate the way you manage the stress. And this affects everyone. It doesn't matter whom you are, figuring out ways to be able to mitigate and manage those stresses so that we can all get through this. And one thing we did at our hospital, and maybe if you were driving down I-90 at this time over the last month, you saw in our hospital there's a big banner that says, "We will get through this." And that's a powerful message, because times like this, that what we have been going through and what you've been having to endure on a regular basis, message of assurances and hope are really powerful. Even if you're able to just tell another friend, like, hey, we'll get through this. That creates a lot of levity and a lot of buoyancy in your mental well-being. So at first, I just wanted to kind of set a stage and validate to you what you've been going through and what you've been experiencing, and the fact that accessing urgent or an emergency behavioral health care and medicine, well, the way you access it has changed. And at the same time, many of you are afraid to go to the emergency room, the emergency departments of your local hospital, because, well, you don't want it to further cause a load to the overall healthcare system, and at the same time, potentially, you haven't wanted to expose yourself to any potential contraction of the virus. And so that's what we're seeing is actually the volume of individuals that are going to the ERs has come way down, which is particularly alarming because the general public, the conventional wisdom is access to emergency or urgent mental health care goes through your ER. And I'm here to let you know that it doesn't have to anymore. Because of now how everything has moved to this virtual platform between our hospital in the Northwest Behavioral Health, CHAS, Frontier, all having moved to that tele or virtual platform, you're able to access care without having to go to an ER. Now, I want to also add a clarifier to that. If you or someone you're connected to is in an emergency behavioral health crisis, like suicidal ideations, things like that, you want to either call 911, you can call our hospital, or Frontier's crisis line to be able to get the proper care quickly and potentially avoid the ER altogether. The way that we've been able to access care, again, has changed. There's been a lot of change throughout this whole period of time for what you've had to do to manage your daily living. And now, okay, well, I have a family member or a friend that is not doing well. I can see them decompensating. You know, you can see that in, you don't have to be a clinician to really start to see depression. You can start to see that in the individuals that you know and love. And being able to get those individuals, or even yourself, the proper care that you need to be able to get through this period, because we will get through this, is very, very valuable. We want to avoid bad outcomes right now. And the best way to do that is to access care. One other thing I wanted to make sure that everyone that's watching and the general public realizes is our hospital, you can just walk in. You can, you're going to go through basic CDC guidelines, COVID-19 protocols, but if you or someone you're connected to is really struggling, you can come in, have that mental health assessment, and we'll figure out the best way to take care of your needs. But on a much larger scale, I'm sure people that are watching right now, there's stressors that are occurring every day. And your coping skills have been compromised through no fault of your own. And so what we want to be able to do, there's links that are being posted on this Facebook feed about accessing care, so that you're able to either connect with someone at Chaz or Frontier or our facility, your own private psychiatrist, however they've moved their platform to be able to deliver care. But this is a time when you want to be able to connect with them on a regular basis, so that you can re-engage coping skills that you may not be aware of, to be able to manage this time. Myself, I'll just be very transparent. I enjoy fishing. I haven't been able to go fishing. And so I've had to find other ways. I think I just wanted to allow you to recognize, again, this is something that affects all of us. So the way that even I manage stress has been changed. Outside of that, I wanted to give an overview of also what has occurred with our community. I am the behavioral health lead for the Emergency Command Center. There's 2 meetings that I lead, along with Samantha Clark from Multicare and Tanya Stern from Spokane County. There has been a very large gap for individuals in our community that actually don't have phones. With the move to everything going to a telehealth platform, individuals in our community that don't have access to phones or don't have phones have been left without access. So there are things in motion now within the command center to be able to meet that need, so that the individuals that didn't have phones or don't have technology can access this care that has now moved to a different delivery system versus the way that they used to, because the last thing we want is our citizens decompensating psychologically without the actual ability to connect with the care that they need. In the coming days, more of that will become clear as far as how that will roll out, but that is something that we're acutely aware of and addressing that need. Outside of that, I wanted to just kind of wrap that up, but I wanted to really validate what all of us are having to go through on a psychological basis, and being able to connect with entities that can offer psychiatric and mental health solutions for you. And as I said, through Chaz, through our hospital, and through Frontier, all of us stand ready to be able to meet that need. You just need to be aware of how to access that care, to be able to check in and maybe reevaluate some of the coping skills. If medication management is necessary, address that too. Again, I wanted to also say that we will get through this. That message of assurance and hope is a really powerful thing, because we will. Outside of that, unless there's some questions right now, that's really what I wanted to let everyone know right now.
Perfect. Did we do do have some questions for Dr. Lutz.
Okay.
Our first question, Dr. Lutz. We have heard over the last couple of days about some contaminated test kits. The question is, are any of those test kits, were any of those sent to Spokane? And the second question, to piggyback off of that one, can you update everybody on the testing capacity right now here in the area?
Sure. So, yes, as made the news over the weekend, there were about 12,000 contaminated test kits that were available at the public health lab in Shoreline, but none of those were transported to the Spokane area, so I feel very good about that standpoint. With respect to testing capacity, we are constantly being reassured by our healthcare partners that testing capacity is good. I will tell you that there is intention at the state level to increase that testing capacity and testing requirements over the next few weeks, so stay tuned for that. But certainly right now, for those individuals who have symptoms or concerned about having COVID-19, we will, as in the past, recommend that they contact their provider, go through the nurse's hotline, and then seek care and treatment as best defined by those individuals who are there to answer your questions.
We have another viewer wanting to know specifically about nursing facilities, making sure, or what's being done to make sure that they're testing for COVID cases in these facilities.
In long-term care facilities?
Correct. Yes.
Yes, there's certainly when we collectively look at risk areas, certainly long-term care facilities, other congregate settings such as jails, such as what we call assisted family homes. There's a lot of those areas where you have large numbers of people in close proximity, the shelters, we've talked about that in the past. So those are all, again, high priority areas for us. We have been working very closely with the administrators at the healthcare facility, those long-term care facilities, over the past weeks. They have been well educated on appropriate use of PPE. That has been an issue in the past about availability. That has been improved, however, as of the past few weeks. So when an individual is having any symptoms, and even mild symptoms, the recommendations are for those individuals in those long-term care or other congregate settings to be tested. And that's why we are seeing small little outbreaks. As you know, there was an outbreak in one of the assisted living facilities over the past few weeks that we've been monitoring very closely. But long story short, we have been providing recommendations, and those testing materials, as well as PPE for healthcare workers, are being made available to those sites.
We have a question for Dan, actually. Dan. So Dan, we're getting questions from individuals who maybe going into this pandemic had never experienced these mental health crises before, so they don't have a provider in line, or they didn't. Well, what would you provide as far as guidance for somebody who's facing a mental health crisis that is new and doesn't have a current provider?
So the first thing is to validate the fact that, like, hey, this is a typical reaction to how you're feeling. The fact that you don't have a mental health provider that you have regular contact with is exactly the reason that our hospital, that Chaz and Frontier exist, is so that you can contact any one of those three entities, whether Chaz through their crisis line, through Frontier through their crisis line, or through Chaz they also have a phone number just to call. It's on their website on chaz.org, and you can set up a virtual appointment. And then at our facility, you can just walk in if you need to, rather than, or you can make a virtual appointment via outpatient. But the main thing is I want the general public to recognize is that you should not feel any barriers to getting the care that you need in order to endure this process. And one other thing that we're really starting to identify is that over the next 4 to 6 weeks is when the most amount of mental stress is being impacted to the individuals in our community. The first few weeks of being able to think, okay, well, we can kind of manage this, we'll be able to do this and this and this. And then after a few weeks, it starts to get a little more challenging to manage the stresses of the day, and thinking, okay, well, when is this going to get back to what I consider a typical life? And so as you or your friends or family, you started to recognize individuals that you're connected to are really struggling. And again, even yourself. I highly encourage you to access mental health care right now. And again, if you don't have a mental health provider that you regularly utilize, that either through CHAZ, through ourselves at Inland Northwest Behavioral Health, or Frontier, can make sure that you are getting the help that you need, or the family member or friend that you have is getting the help you need. We want to make sure that there are no barriers, and for you to be able to get the care that you need immediately. One thing that creates a lot of confusion is, again, I stated a little earlier, our general populace, the conventional wisdom is access to emergency mental health care goes through the ER. And because of this pandemic, as I had stated, we're seeing volumes in the ER that are I'd say COVID symptomatic related volumes come way down, because people are then, are avoiding the ER and potentially psychologically decompensating even more. And so this is something just from your home. Pick up your phone and call. And either make an appointment just to check in, or there are various levels of ways to be able to handle what you're going through, because that's what we're here for as a community, is to be able to provide the care that you need and the help that you need during this time.
And as a follow-up to that, again, for an individual who hasn't gone through the process before, can you provide a very high-level overview of what an individual might expect if they access that virtual appointment or walk through your doors? What is the first steps, just to kind of get somebody over that first hump of maybe some anxiety they have about that?
Sure.
process?
So, great question. So, I can speak to our hospital specifically as far as those protocols, what that looks like. Again, you can just walk in. Our hospital is located just a few blocks closer to the freeway than Sacred Heart. It's the one that has the big banner that says we'll get through this. So you don't need to call. You can literally just walk in. You'll go through that COVID-19 screening that's all per CDC protocol. And then just check in, and one of our mental health professionals that works in the intake department will meet with you. Typically, right now, it's within less than an hour to be able to sit down with them, talk about what's going on, and start to figure out the level of severity of what you're suffering and what you're going through. So whether that means that you just need outpatient care, then we would set you up with outpatient services through our outpatient services within the hospital. If you're in a space that clinically needs inpatient for a few days to really get things stabilized, then that's what we're going to do. Because again, the main thing is getting the care that you need. So speaking to our facility, again, you can call. And I know the phone numbers are being listed on this, but you can just call our main number and say, hey, I'm not doing well, and I need to talk to somebody. It's really that simple. And then be able to just come in, have that evaluation done, and figure out what you need in order to provide the proper mental health care that you need. again, it's it's not a very complicated process to be able to just come in, have a seat, fill out a couple pages of paperwork, and then sit down with a mental health professional and talk about what's going on, so that that mental health professional within our facility can make a proper determination with you about what you need. And again, if it's outpatient, we'll coordinate that for you. And if it's inpatient, we have that too. And so, again, you can call ahead of time if you want before you're coming. I know that it probably feels good just to even say that you can go somewhere for mental health care. But I also want to encourage the virtual platforms as well. If you're not in an urgent or emergency type of situation, I know that is a subjective term. You know, what is urgent to one person may not be for the other. And we want to avoid bad outcomes. So the more connectivity that we can have with individuals, just to even vet something over the phone, is going to be a help. So again, to just kind of walk you through that, it really is quite simple. You can call on the phone, say, "Hey, I'm just on my way in," or you can show up unannounced. We take walk-ins at our facility. Again, it's then meeting with that mental health professional. You have that patient right if you want to bring a friend, if you want to bring a family member, or if you just want to do it on your own. These are all things that you can control. That is a powerful thing right now, being able to feel some sense of control in a time where there are a lot of things we don't feel like we have control over.
And our final question today will be for Dr. Lutz, and it's a question we've gotten more than once over the last few weeks, and it's a question you've answered. Why does somebody that no longer has symptoms, why do they have to wait 2 weeks to go back to work? How do we come up with that 14-day number? How does the CDC come up with that number?
Yeah, so the duration that somebody has been asked to stay out of work is based on a period of time that we know people can potentially be contagious. And so we know that 14 days has been identified by researchers as that period during which people are maximally contagious and then become less contagious. And so those 14 days are based upon the science of COVID-19 as we know it right now. So if I may, I just want to give a couple of other sort of follow-ups to what Dan said. Just a little stress reliever. Set up a routine. If you haven't established a routine, I strongly encourage you to do so. It's really key that you know that you're going to be doing this and that. It just really helps to get you through the day. Give yourself a media holiday, excluding this Facebook Live show, of course, but give yourself a media holiday. There's so much COVID-related information out there, it's overwhelming. Turn it off for a day or 2 or 3. It's still going to be there, but maybe just don't pay attention to it. Don't make it front and center. Get out, be physically active. Physical activity, exercise, as good as medications for mild and moderate stress. So be active. And if you see somebody, wave. That social connection is really important. Make eye contact, wave. How are you across the street? As I mentioned, I think the other day, it was really rewarding to see neighbors on Sunday, all physically distancing, walking their dogs, 8 or 10 people walking down the street. That's what you need to do to, again, alleviate some of the stressors that we're dealing with right now. And pray, meditate. Give yourself some time, give yourself some space where it's just you, where you're just sort of thinking but not thinking about necessarily the stressors that you're having to deal with through life. So routine, physical activity, physical distancing, but getting out and being physically active, media holiday, and then, as I said, prayer, meditation, what have you. So with that, I will say goodbye and stay home, stay healthy, save lives, and wash your hands. Thank you. We'll see you tomorrow.